All right, hello, welcome to this week on Connected Moms. We are normally meeting at the Newton Public Library right now, but amid the current situation, we are moving onto the interwebs. So, welcome. I am joined here with our special presenter, speaker, educator, doctor. Anyways, so we've got Dr. G here, and he's going to talk with us about healing through the postpartum period, especially using healing foods, real foods, and different lifestyle practices to help overcome, all of the different things that we've got to heal through that time. So thanks for joining us.
Thank you. Well, I feel as a guy, I'm kind of an expert on
all things
postpartum, all things women. As a white man in America, I feel like I'm an expert on female health.
You know all about reproduction.
I knew the good part.
Yeah.
So, luckily, you birthed a baby.
I have.
Yeah.
A baby has.
So tell them about your baby real quick.
Okay. So I grew a child, a human, inside my body, and then evicted it about 3 weeks ago. So
3 weeks.
3 weeks, 3.5 weeks technically.
Yeah.
But yeah, so we have a little baby Willow at home.
Aww.
So I am freshly postpartum.
So anything I don't know, she might have personal firsthand knowledge about. And you run that group, right? The Connected Moms.
Yes.
So tell us about that, because you guys meet. Is it weekly or monthly?
We meet weekly. So Connected Moms is it's a group focused for mothers in those first couple years postpartum. And our two big pillars that we work on is education and then peer connection. So education is huge. I mean, we talk about anything that can fall within those first couple years. So it can be things around breastfeeding, things around healing the body, parenting, early childhood. And then we also want that connection of peer support. Sometimes motherhood can be very isolating. Maternity leave, we're often just locked in the house with someone who doesn't form words or sentences, and so we can get that disconnection. So this is a time for moms to come together and talk and discuss what they're going through. So they can also get that piece too.
And you started this?
Yes,
we started. You said it was grant funded too?
Yes.
That's awesome.
So we are working through the Harvey County Health Department as well as the Kansas Breastfeeding Coalition. And so they let us meet and do all kinds of fun things. So that's been a journey over the last couple months as we've been getting this started.
Nice. Yeah. And I have personally created 4 people, 2 twins, so only 3 times. So technically I've only had sex 3 times. But I feel like I know what I'm doing now. So
mastered the craft.
After 2 times, the 3rd, I figured out already how to make twins.
You're efficient.
See what I'm saying? That's gifting right there. So, but only boys make boys, so I didn't really do anything spectacular then, I guess. They're all, yeah. All right. I was there through a lot of screaming. Let's just say that. Yeah. And I was a stay-at-home dad. At the beginning or the end? I was a stay-at-home dad, so I was always like, I like doing laundry and dishes, and I don't know, it makes me feel like a father or connected, Yeah. So we're gonna go through this. So some people get a vaginal delivery, some people get a cesarean section. There's no right or wrong with that. But we want to talk about that. And we also want to talk about the hormonal kind of like process that's going on. So we'll talk about the 1st week, 2nd week, 3rd week, 6 weeks, 1 month, year. I did 1 month after 6 weeks, but that's not right. But yeah, so we'll break that up and kind of talk about the expectations. And then as those kind of like symptoms come up that women are dealing with, we want to talk about some ideas that we both have for what new moms might do and how to kind of balance hormones, how to kind of balance mindfulness reset, and then like the anti-inflammatories and physiological changes. We want to have some kind of natural solutions for that. So If you guys have questions for me or Dr. Mallory, post those. And I know a lot of you guys post offline too. So anybody that watches offline, but hell, everybody's quarantined. Aren't you guys at home? Nobody's at work. We're all about to lose everything.
This is what all the cool people should be doing right now.
That's right.
Watching this.
You got nothing left to do with your life.
There's no NFL, no NBA.
No, nothing.
Well, no NFL anyway, but no sports. So
And they're canceling the movie at the movie theaters.
that's just right. No cinema.
And the gym's closed.
So basically, you're all on Facebook.
All right.
We know it.
We're here for you guys. We were going to do this, but since you guys are trapped, we did this.
Yeah.
Yeah.
It's a service for you, really.
All right. So okay. So you tell me what if I mess up on anything, you have to tell me.
Okay.
Okay. So full recovery can take months. So there was a discrepancy here. So one thing said that moms say that it takes 6 to 8 weeks on average to recover, but then research said 6 months.
Mm-hmm.
So what's the discrepancy, you think?
I think that can be common. I mean, it just depends on sort of the depth at which we're looking. So at a superficial level, we can, complete our normal activities of daily living. Sure. And after 6 to 8 weeks, a lot of the restrictions are removed and we can do the little things. But if we're talking about are all of the connective tissues inside your body actually healed? Likely not.
Yeah.
Are you able to squat 200 pounds if that's what you're doing pre-pregnancy? Probably not at 6 weeks. I think that's fair to say. So it depends what you're looking at. You're at 6 to 8 weeks. Yeah, we're able to do the little things and get through and be self-sufficient, but it's a long process.
So 6 to 8 weeks, that's the suck it up, buttercup, push yourself out there, start getting stuff done. But then you're really not back to real self, maybe 6 months.
Mm-hmm.
And I think in the stuff that I pulled up, it even was like a year. You should feel kind of like you're back in your own body, kind of thing.
Yeah, I acknowledge the first year as the postpartum period. You've got the immediate postpartum period, which is anywhere from those 2 to 6 weeks. But really, though, that whole year is a time to heal and to adjust and to transform into motherhood.
Yeah.
And honestly, postpartum is forever because you can never unbecome a mother. You can't ever take that process back. So
that's right.
Somewhere where you are always a little bit postpartum.
Well, and I also thought about the difference between healing and coping. So are you really healed or kind of back to normal, or at 6 to 8 weeks, we're just by then mom should be able to cope with everything.
Yeah, absolutely. You wonder how much of that is the modern American societal view. Maternity leave is typically 6 weeks. And so,
is that it?
Yeah.
Holy crap.
So it's usually about 6 weeks. That's what, most people recognize. Some people go back at 2 weeks and some will extend it a little bit longer, but I think society generally says you've got 6 weeks. So hopefully you're there, or if not, it's that bucket up.
In other countries, it's up to 6 months, isn't it?
Oh, there are some countries that have maternity leave for 2 to 3 years.
Holy crap.
Yeah.
We're so far behind on this.
Yeah.
Well, and our friends in Japan, the dad got paternity leave because, then I told people about that and they were like, well, why the hell does he get time off? Because she just had a baby. She literally is all wounded and healing and she needs someone to help. So
yeah.
So that's a really interesting concept change as far as Americans, where it's kind of suck it up, rub dirt in it, get on with it, get over it, as opposed to really we want healed, healthy, happy people. So how to overcome coping, we'll talk about that. But breastfeeding is one. So breastfeeding actually makes hormones like progesterone, which then make you feel happy. But you have to overcome, or not just coping with, say, breastfeeding, or coping with sleep deprivation or the adjustment to motherhood. Those are kind of your three. That's right, because those are your three main things for recovery. And then your body.
Mm-hmm.
Yeah.
You just say the word breastfeeding and it makes my breasts hurt because they need to express milk. It's like
She didn't bring her baby.
It's like that baby cry. You just hear the word breasts, and you're like, need to express. Anyways, sorry, go on.
So expectations for week 1. So part of it. So if you guys are moms or parents, feel free to chime in with your kind of knowledge about this and your ideas too. Because again, just like the idea of connected moms, it's about community. And if you guys read enough books, you realize that they all disagree and everybody has their own opinion. And there is probably not one right way at all, right? So by expectations by week 1. So the vagina, if it's a vaginal birth, probably hurts a lot. And that really depends on the tearing, whether they did a episiotomy. Now, like when we did natural childbirth, Sharon Foster, who did ours, she put warm walnut oil and like lubricated everything so that basically it softens everything up, warms everything up, and there was no tearing. Yeah. But
it can be huge to use that, or like lots of like warm compresses are used throughout birth, to help aid in that stretching.
Yeah,
for sure.
And especially when they use Pitocin instead of allowing your body to make oxytocin, then you're trying to stretch tissue that is not ready to stretch, because that hormone allows everything to elongate and come loose.
Yeah, the pushing stage in labor lasts about an hour, sometimes a little more, sometimes a little less, and faster is not better. Just like you said, like your body needs to stretch slowly, so it stretches, and then baby kind of moves back up a little bit, and it gives the tissues time to breathe, and then they stretch, and it's a little what's the word?
It's like Wednesday after Taco Tuesday.
Yeah.
Holy crap! As a guy perspective, like, okay, I'm a doctor, I know all this stuff. I took OBGYN stuff, and when Ellen's head was coming out of her vagina, it was like, oh, the crown is cresting, right? So it's like, oh my God, there's her head. And like my whole knowledge is spirit. And I was just like, she can't breathe. The vagina's not covering her mouth and nose. Like she can't breathe. And I'm sitting there like, why isn't anybody freaking out? And then her head goes back in. I'm just like, she's got to get out and breathe. I'm just like freaking out. And I was just like, why are they not freaking out? Why am I the only one freaking out? And of course, the umbilical cord is still connected. So I don't know.
Yeah.
You know,
a lot of that, goes out the window, like whenever you're in the seats of the parent. Yeah.
The best thing my ex ever said was like, anytime like my daughter would be like lethargic, high fever, something like that, and I'd be like, oh my God, what do I do? And she'd be like, well, what would you tell a patient to do? I was like, oh, fever's good, it's fine. She should be lethargic, she'll get over it, and it'll be fine. And then, like my whole brain shuts off when it's when it's your kid. But thinking like, what would you tell someone else? That makes a big difference. And then uterine contraction starts. So the uterus is the size of a pear, and it grows to what?
Watermelon.
Damn, that's crazy. So that pear goes into a watermelon, and then the whole goal is to constrict that all the way back. So the uterine contractions just start within the first week, and
they start immediately.
Oh yeah.
And then they complete within the first week.
What? That's crazy.
Yeah.
That is true, huh?
Yeah, the uterus is all the way.
A week? That's insane.
So it starts all the way up at your diaphragm, right during labor, and then by about an hour after birth, it should be already down to about the height of your belly button.
What? That's crazy.
So it makes, what is that, 8 inches or so in the first hour, and then it just continues to shrink after that.
That's amazing.
Yeah.
And then for C-sections, the incision should be painful. So they make that little slit across, and then they force the baby out through the little hole there. Now, there's a lot of issues with that, but that's not about this. So, and then, so movement should still hurt because, again, the baby came through your abdomen, which is all your abdominal muscles, which is twist, turn, lean back and forward. So all of that stuff should still be pretty painful. So that's normal. So we'll talk about things you can do about that. And then movement is a must because it prevents clots. So I don't think the vaginal birth you got to worry about blood clots as much, or do you?
It is. It is something you have to be concerned about. You'll pass certain number of clots up to through your
So-
after vaginal birth too.
So they need to be up and moving around at least. And then hormonal changes, basically, again, to maintain pregnancy, its progesterone gets crazy high, which is your feel-good, happy hormone. So you should be glowing during pregnancy. Progesterone gets converted to cortisol, or stress hormone, and progesterone is a cholesterol hormone. So you never lower cholesterol, or else you become infertile. You never decrease progesterone during pregnancy, but a lot of women have infertility, like 1 in 7 couples now. But
Mhm.
if you think about, like, we're literally taking drugs to lower cholesterol, making dietary changes, taking niacinamide to lower cholesterol. That is the progesterone that's supposed to surge so you can maintain a pregnancy. So most pregnancies in the U.S. end up as auto-abortion because the body says there's not enough to maintain, so let's reabsorb it and start back over. When that happiness, that crazy amount of progesterone drops down, then you're going to have some changes, right? So it can be chaotic, hormonal changes. Then obviously you feel overwhelmed. Now, one thing I noticed is when I did pediatric rounds, you would have mom kind of doped up, and then they take the baby, and they would have the curtain in front, and they would pull the baby out through the C-section, and then they go put it in the baby cooker, right? And then, which if the O2 sats are too low, you don't go, oh my God, because that's what I did. And then parents look at you, go, oh my God, what's wrong? I'm like, it's fine. But they put them in the baby cooker, and then mom goes and gets sewn up, and then she ends up back in the room, and then hours later the baby comes, and they're like, hey, you didn't see this come out of you, but it's yours, right?
Mhm.
And so then, of course, there's issues with that, because if you're drugged out, you want from vagina, it comes out straight to breast, so you not only see that thing come out of you, but then it automatically makes physical contact, and the oxytocin,
Mhm.
you guys fall in love and all that, you have that connection. But if you have C-section, you might start experiencing some kind of a postpartum depression with that. Secondary to the meds, but also because of the disconnection part too. Yeah?
Yeah, I think so. And even if it's not to the level of depression, I mean, you hear a lot about the baby blues.
You're right.
Yeah,
Yeah.
and that's even more common than postpartum depression. And the baby blues is just that little bit of progesterone dropping is the big thing that it's attributed to. But just that adjustment period of like, you now have this new human in your life, and
Yeah.
what's going on. So a little bit of coming to terms with that, and
Yeah, because it gets real fast.
Mhm.
And even with moms that cry a lot, feel exhausted, that's all normal. That's all normal. So we'll talk about things that you can do to ameliorate that, make it a little bit better too, but also accepting. It's okay. You're going to hurt.
Yeah.
It's going to be frustrating. It's going to be exhausting. And then it won't. And that's why cortisol numbs out memories, right? So cortisol, stress, will blank out your memories. So then people go, hey, I don't think birthing a baby was too bad. We should do it again. And that's why. Because
That's why.
otherwise, if you had a sharp memory, you'd just be like, no. But one of the funniest things to ever do as a guy is to go up to a group of women at a table and be like, I read that, like, what's it called when you birth? Labor. I heard labor pains aren't that bad. And then I
Oh gosh.
will guarantee every
I can't
woman
imagine.
will start telling her story, and then you just walk away. It works every time. So then by week 2, the vagina, the bleeding should taper off by then. So, I mean, clotting
Mhm.
should take place, but you also, you'll have bleeding off and on for a while.
Yeah, it'll be moving to more of like a moderate to moderate mild at
Yeah.
that point. Yeah.
So they're not using tampons for that, or pads, or?
No tampons. We want to avoid anything that's all up in your biz. So the first few days, it's usually actually a diaper.
Nice.
Super cute. And then a heavier pad, and then you can kind of lighten up the pad as you go.
And so by week 2, you probably start ending up with vaginal itching. So we can talk about that, but that's the healing process. So we'll talk about things that would speed up the healing process. And then C-section, they should still just be a little sore, maybe itching. And then breast tissue, by week 2, they might start experiencing sore nipples. So we'll talk about solutions about that.
Mhm. And also a lot of like breast engorgement's a little more in that first week
Yeah.
when the milk comes in and you just feel full and hot and
Yeah.
all kinds of things. And some of the things we're going to mention for sore nipples fall into that engorgement as well. For helping with that.
And then by week 2, baby blues, postpartum depression might start, which is still kind of normal. So sleep, sadness, anxiety might be kind of normal. But again, if it gets worse, or you can always talk about it. So we'll talk about some kind of hacks for that from mindfulness. But by week 6, the uterus is fully back. There should be almost no bleeding, and sex activity can start. By week 6? That's a month and a half?
Technically, yes.
This is probably written by a guy. Probably by a guy.
Probably. It's the medical system.
So you said non-penetration kind of sex would be better for like...
Yeah, you definitely want to progress slowly back into sex. You don't want to just go from nothing to the whole shebang. But starting with intimacy, yeah, non-penetration.
What's that?
Well,
Intimacy.
You know, displays of love, that kind of thing. And then slowly, yeah, working up to the birds and the bees.
It's probably written by a guy. So, yeah, you know, like if I just gave birth a baby, like I would be like, you need to stay away from me. Like you caused all this. And then C-section, by week 6, they can start lifting heavier objects in a baby. And again, a little itchiness from the healing. Hormonally, by week 6, you're probably still exhausted, overwhelmed, and may have deeper feelings of depression. And then by 6 months, you got it down, right? 6 months, you're like, bam!
Totally nailing it.
Maybe. So full bladder recovery. So that's where they cough and they don't pee in themselves all the time, which again is not normal. When moms say I have bladder leakage and they're like, well, I had a baby. That's not normal.
It's common.
Common.
It's not normal.
But you should be able to fix that and reverse it. So part of that we'll talk about is the, I don't know if I added that. Kegel exercises, right? So if you have weak arms, you got to exercise them. So if you have a weak little sphincter that prevents you from peeing yourself, then you got to make it stronger. So the Kegels, yeah?
Kegels, yeah. Yeah, I mean, there's the pelvic floor can be too strong or it can be too weak in a sense. Kegels are great whenever it's got that weakness to it. There's also different techniques if it's hypertonic, which means on a lot. And then you need some relaxation techniques. So it kind of depends on the situation.
Okay.
Super cool stuff.
And then things like red raspberry leaf tea, it actually will help with that too. Yeah. So
in the comment.
yeah. So Lane says full bladder recovery ? That's not something my body knew about. I know, and you know, but interestingly enough, like nitrates, sulfates that are added, wheat, dairy, chocolate, sugar, stress, that actually stimulates the sympathetic nerve, which overrides the parasympathetic nerve, which then makes that muscle a little bit weaker. And then when you cough, stuff can squirt out or jump on a trampoline, that kind of stuff. But if you get rid of those things from your diet, then most of that muscle should come right back, and then suddenly people don't have what's called
incontinence.
Stress incontinence. Yeah. So that's a wonderful thing for people. But raspberry leaf tea is sometimes like we've had patients that are totally incontinent, and then boom, they get it all back.
That's awesome. Yeah.
Yeah.
Raspberry leaf tea is super common in the postpartum period because it helps with all of your smooth muscle contraction. So it's great for uterus healing as well.
And then, so by 6 months, so full bladder recovery. If not, use red raspberry leaf tea and Kegels. So that gets the skeletal muscle that you control, and then the smooth muscle you don't control. And then milk might start drying up, but again, what's the recommendation? Like 2 years? You want to nurse?
Yeah, so it depends who you ask. The World Health Organization recommends breastfeeding 2 years and beyond. The American Academy of Pediatric recommends 1 year and beyond. Both of them say exclusive breastfeeding until 6 months, and then that's when you can start to introduce solids.
Yes.
So sometimes the milk can dry up around 6 months, usually because we're starting to add more foods, and so you might be doing fewer feeds.
Yeah.
But it just kind of depends on if your frequency of breastfeeding is changing.
And there's some things that are called galactalogs that you can add that'll help with that too.
Mm-hmm.
And then your period might come back, which is great because you get pregnant again. That's awesome. And then you can have Irish twins.
Yes.
And it is St. Patrick's Day.
Oh, yes. How fitting.
And then no difference with C-section. And then usually by 6 months, hormonally, they say most people have kind of like starting to feel more positive. I think that you figure out like, all right, this is real. Like I got a little routine going. Maybe you have a really good husband or boyfriend or partner that allows you to go to sleep and they take care of the baby and they feed the baby and then they take the baby out and then you have family. And so, you know, you can actually like heal from the inside out too, you know, mentally. And then after the first year, most women are still dealing with a few extra pounds, but otherwise they feel like their body is like back to normal. Although it will never probably, I don't know if women ever feel like non-moms ever after that.
Probably. I mean, it goes back to postpartum's forever.
Yeah.
And honestly, like if you watch a birth and like the amount of power inside that body, like why would you ever want to go back to your pre-pregnancy body?
Yeah.
Like if you have that much power, like own it. Freaking crush
I
it.
have the power. Okay, so when I did, and we're gonna get into solutions here, but when I was in high school, I got into this medical magnet program, right? So you do all your high school in 2 years, then you do medical rounds for the last 2 years, right? So they made us watch all these videos, and one of my rounds I went to was a birthing one, right? And this woman had a baby that was breech, so the butt was coming out first instead of the head. And so usually we freak out about that stuff, but this is old school. And that doctor, I watched this doctor stick his whole arm inside this woman and move this baby around.
Mm-hmm.
His whole arm.
Yeah.
And I was like, I don't know, 16. I was just like, I'll never feel adequate again in my whole life. Like, that's insane. Like, how do you stick this whole arm in there? And then that was weird enough. And then I watched the first birth, and then the baby comes out, and then it's like as soon as it comes out, like they pull it out, and you're just like, I had this overwhelming sense of joy, like, wow, that's amazing. And then all the stuff came out.
Yeah, just
and
the
then
fluid.
I was like, like this. I was just like, it went from such a high to just like, oh my God. Like they did not prepare me for this. So as a teenager, that was pretty crazy. So
Sex ed.
Yes.
In one moment.
Yes. So, and then most people by a year are adapting to motherhood, you know, kind of figuring that. So, out of all that kind of expectation, whether someone does it's coronavirus, I touched my eye. How you doing?
Don't you dare.
So, whether it's vaginal or C-section, or there's the hormonal kind of process, what are the solutions, right? Mm-hmm. So I came up with mine, and then I had Dr. Mallory kind of help me tweak some of these too for what I didn't know.
Yeah, some experience there.
What did Elaine say? Believe me, it's not fun for
yeah.
When the doctor has to
turn the baby that way. Yeah, during my birth I had to have a little extra motivation for flipping as well. It's not
really?
super fun. Luckily, it wasn't as traumatic as that, but.
Did you get chiropractic care while you're pregnant?
Mm-hmm.
Yeah.
Yeah, absolutely. It was huge. Got adjusted 2 days before, and I got a massage the day before, and then boom, happened.
Nice. So let's talk anti-inflammation. So the whole process of birthing a baby is very inflammatory. The healing process is inflammatory. And so anti-inflammatory process or anti-inflammatories that are natural are going to help, because there's a big problem with that when you do something like you're having this bleeding from the vaginal birth or the C-section, but then you have COX-1 inhibitors like ibuprofen, aspirin, which then can lead to increased bleeding, which would then be problematic. COX-2s cause cardiovascular damage, so the medications like Vioxx, Mobic, Celebrex, that can be problematic, and that can still cause some extra bleeding. And then steroids can't really, they don't do that for the bleeding. But there's 3 pathways for pain and inflammation. So there's what's called COX-1 or cyclooxygenase 1. So that's door 1. COX-2, which is door 2, and 5-LOX, which is door 3. So there's 3 doors that go to pain and inflammation. So we want to be able to regulate those in some fashion that's not harming as we're healing. And that's where we get into natural medicine. So I wouldn't do willow bark, which is a COX-1. That's where they came up with aspirin, ibuprofen. It shouldn't cause bleeding, but there's the theoretical part that it might. So there's so many better options that you shouldn't do it.
And aspirin's also frowned upon if you're breastfeeding, because infants aren't supposed to take aspirin for the first 2 to 3 years, and aspirin can be passed through breast milk. So also from that standpoint, avoid it.
Yeah. So your best then COX. So if we can regulate 2 of these 3 doors, that's where like turmeric or 95% curcuminoid therapeutic dose, or ginger. Those are both ginger is probably one of the better ones, because it'll help with nausea, vomiting, and then also knocking down pain and inflammation through the pathway. And ginger is like 350 milligrams 3 times a day. Turmeric 5,000 milligrams 3 times a day. You can take more. I think it's, I forget what the dose is, but it's like an incredible amount of grams that you'd have to take before you start to see problems. So turmeric's a really safe one. Ginger's super safe. You can just kind of wing it on those, which is great. But with like aspirin, ibuprofen, and Tylenol, that's the leading cause of kidney failure and liver failure in the United States. So can't monkey with those. You take too much Tylenol and you kill your liver. So, but you take too much turmeric, your immune system's even better. So, and then boswellia and frankincense. So frankincense or Jesus oil. So that's a really good one that you can buy essential oil. And if you put it on the actual tissue that's damaged, it's a very powerful wound healer. And then the active ingredient that you can buy is called boswellia. And so boswellia you can take internally, but when you take stuff internally, it has to go everywhere in the entire body and be at therapeutic levels at the place you need it. But if you put frankincense directly on a tissue, it goes into that tissue. So if my hand hurts, I put frankincense here. I can also take it internally and go everywhere, and hopefully from the inside out. So frankincense is a wonderful way to augment with turmeric or ginger, because you're doing inside out and outside in with that. If you have C-section, I would mix frankincense and lavender together, and maybe even a carrier oil if you're sensitive, and put it on that incision to help speed up that wound healing. The other big one that's a COX-2 and a 5-LOX inhibitor is omega-3s. So like 3,000 to 6,000 milligrams is the therapeutic dose for that. But there's a big kind of switch that's happening in surgery. So some surgeons don't like you to be on it at all because they think it'll thin your blood. But then now surgeons some of them are saying to do fish oils because they speed up the wound healing process and they have less complications. So old school, it's like, I don't know anything about this, so don't do anything. New school is they're starting to have doctors that are like, yeah, do this because we want less complications. So, yeah. So Lane points that out too, that the medication versions will go through your breast milk. But if you have turmeric or ginger that goes through your breast milk, or frankincense, it's even better because the baby was compressed and squeezed through that vagina, so it has its own little trauma. So if you're passing that through, that's great. The other thing is, one of the reasons babies do so well through being crushed is they go straight to breast, and breast milk is morphine. So, casomorphin in there is a drug. So they're all good. Mom should drink her own breast milk.
Fish oil. So there you go. There's that fish oil.
Yeah. So, Lane's like, they told her to stop 2 weeks. That's pretty common. But now you're seeing some docs that actually change that recommendation.
Interesting.
But tell them turmeric, ginger. They won't know anything about that. So, it's all good. The other thing is diet. So the intake. So when we go through stuff with patients, we always talk about diet. Food is medicine. The average American, or say the average omega-3 anti-inflammatory fatty acid to the inflammatory fatty acid should be 1 to 1, maybe 1 to 2 in nature, right? A little bit of inflammation is okay because it makes us stronger and we grow. But the American diet is horribly inflammatory. So for every 1 anti-inflammatory we have 40 times the inflammatory. And a high omega-6 diet, so like corn-fed cows, corn-fed chicken, corn-fed fish, the number one, say, pathogenesis of that or result of that from prostaglandins is increased pain and inflammation. Like mom should literally be in more pain. She should have more inflammation if she's eating an inflammatory diet. Now, reverse that. If you eat wild-caught, free-range, grass-fed, grass-finished meat, then that animal is high omega-3, and then all of a sudden, once serving a cold water fatty fish like salmon or tuna or halibut or mackerel, cod, sardines, those are your low mercury, high omega-3 oils or fish. But one serving of that salmon is just as effective as a full-strength ibuprofen for getting rid of pain and inflammation. So then you don't have to take anything for pain and inflammation, right? Mm-hmm. So that a mom's diet should radically be different after, during birth and then through partum and then postpartum, definitely. So that's a huge one. So stop causing pain, start undoing pain. Hormonally, we said there's a lot of fluctuations with postpartum moms. So we want some things that kind of round out. And there's things that you can take that amp your hormones up, that artificially lower them. But the reality is every country has what are called adaptogens. And adaptogens are those herbs that you can take that lower if they're too high, but raise if they're too low. So adaptogens are perfect ways for postpartum women to help regulate or balance hormones because they don't mess it up in the process. So there are always crazy names like ashwagandha, shistosandra, rhodiola, eleuthero, holy basil. That's an easy one. Or tulsi. That's what the Native Americans used. Every country uses their own, but Americans outside of the Native Americans, we don't. We just use milk, or say wheat and dairy for morphine, sugar as drugs, and then when that all fails, then we use sugar or caffeine and nicotine to cope. But you want to balance out hormones. Mm-hmm. So, do you do those at all?
Yeah, I know the one you didn't mention was the reishi. No, you're good. That one's right. The mushroom. It's not an herb. But yeah, I love that one.
So that's the same as shrooms, because I had lots of friends that did shrooms in high school.
I do shrooms every night before bed then, if that's the case. Yeah, there's a really yummy chai mix that I like that has reishi in it.
Yeah, I have some kind of coffee that has mushrooms in there a patient gave me. Mm-hmm. I don't know what that is. But yeah, reishi is a really easy way to get it.
Insane. Yeah, postpartum depression is super common. Yeah. I don't know what the rest of the common is.
Oh yeah, it's we'll see that afterwards.
We'll see oh, okay.
Now wound healing, we talked about now lavender. Lavender speeds wound healing up. So either vaginally or even cesarean section, that speeds wounds heal. I cannot talk. Wound healing up. But it's also a natural antibiotic. And so it'll keep things clean. And as a guy, I got a little wound once from chopping wood because I'm very manly. And then it had a big blister. And then what you're not supposed to do is pop the blister. So as a man, I popped the blister. And then you're not supposed to take the skin off. So I'm a guy, so I took the skin off, right? So then my expectation is I'm going to get a big crusty scab, and then you pull the scab off and eat it so you get extra strength, right?
Yeah.
Yeah,
Mhm.
that's what guys do. And then it's all gross, right? And then you get another scab and you eat that, and then if you keep eating the scabs, it'll heal up. It's,
Yeah, it heals from the inside. Yeah.
yeah. If you
Totally.
don't eat the scabs, I don't think it heals. I've never tried that. But otherwise, that sounds like witchcraft, like just healing without eating the scabs. But what's funny is I put lavender oil in there, and holy crap, it never made a scab. It never got red. It never got pussy. It just was like pink, pinker, whiter skin. Like I literally took pictures. I've never seen anything like that in my entire life. Like that was the craziest thing ever. The other thing is there's a risk when you have open wounds of drug-resistant bacteria. Now, luckily, there's lots of natural antibiotics, but eucalyptus, tea tree, and lemongrass mixed together is more effective than chlorhexidine against drug-resistant bacteria like MRSA or VRE or C. diff, those kind of things. So you don't want to sterilize your environment, but if you have a wound, those will only heal and they'll prevent even drug-resistant bacteria, and it'll speed up your wound healing also, which is great. Honey. Hey, honey.
Hey.
Yeah. Oh, honey does stuff, right? So honey speeds up wound healing, prevents scar. I don't know if I've had a lot of patients try that, but acne, you're supposed to put honey. You ever?
No, I've never tried that.
And there's the medicinal one that's way more expensive.
I guess I have heard of like using like bee pollen and stuff like
Yeah,
that. Yeah.
Alice and stuff. But that's a messy one. I don't know if you want to put honey in your vagina to help a wound heal. Maybe lavender will be a little bit better. And you suggested bone broth, collagen powder, right? And then vitamin C from fruits and vegetables, what makes collagen in your body. So fruits, vegetables, nuts, seeds, berry, legumes, greens. But you can also take collagen, which is just ground up bone carcass, or make bone broth out of the bone carcass. But that's all fine. And there's like, is there ones that you like that's better?
Bone broth, I prefer to just make it yourself. It's super easy to make.
And cheaper. That way, if you're buying better
it's so
meat,
cheap too.
take all the meat off, break all the bones, put them in the crock pot, onions, garlic, celery, carrots, crock pot for like 24 or 48 hours something.
Well, you can crock pot it, or you can pressure cook it for 90 minutes.
90 minutes?
Yeah, which is huge. And you take it out, and the bones are all loosey-goosey. It's insane.
Yeah.
But yeah, and it's super nice because you can reuse bones. So if, say you like roast a chicken or you roast chicken thighs, you can keep those bones and still use them. So like it's a awesome like sustainable practice too, to like utilize your food as many times as possible.
So you put them in the freezer, yeah?
Yeah.
Well, that's a great idea. I think I think that's great. You find carcasses in the yard, you can just
side of the road.
Side of the road.
Grab them and
they're free. Free bone broth. And if it's laying in a puddle of water, scoop the water up.
Boom.
That's probably bone broth too.
It's something. Maybe even fermented foods. They're good too.
Fermented wild bone broth. Stuff. Okay, maybe that'll do that. I'm trying to figure out where our line is. We got to see where we cross the line. All right. So, and a sitz bath.
Those are pretty awesome. So,
tell us about it, because I know the word sitz bath, but I don't know what a sitz bath really is.
So a sitz bath it's essentially a really, really short bath. So it's about 3 to 4 inches. So imagine you just kind of sit in it, and it's just enough to get your whole perineum, that bottom region. Anything that might have had some tearing or stretching is submerged underneath the water. And so the liquid that you use is basically a tea. And so you can use different herbs. There's different blends that you can find. Lavender, like you've mentioned, is super commonly used.
So like lavender oil in there.
Well, no, lavender, like blossoms, like the crushed
Would you can
lavender.
get those at Whole Food or
Mhm.
Natural Grocers?
Yeah, so all of
Yeah.
these are herbs that are in their crushed leafy form.
Oh, okay.
And so just like you would tea to drink, you take those
And you want it to be
crushed.
hot?
Mhm.
Okay.
So then you boil water, put the herbs that you're going to use in it for about 20 minutes, and then cool it down with as much water as you need, and then just plunk her in for 20-30 minutes.
And so comfrey, plantain leaf,
Mhm.
lavender, and then shepherd's wallet.
Shepherd's purse,
Her
silly
purse.
Willie. It's a girl's.
Why is it a girl one?
It's a girl one. But yeah, there's a lot of different blends that you'll see, but those are some pretty common ones.
What about? So always when I think of sitz baths, I think the Epsom salt. Epsom salt?
Yeah,
No?
yeah. I mean, that one's usually more for like muscle soreness.
Oh, okay. That's
I
all
don't-
I know.
I don't know if you're gonna want to put salt in a wound per
Yeah.
se, but go for it.
Be like a coach. Suck it up, Sally.
Yeah.
You can do it.
Ooh, yeah.
What about sore nipples? Because oh my gosh, when my girls got their teeth in, it would be like loving, like I could watch her like nursing the babies, and then all of a sudden be like, oh! It's just like we're done.
Yeah.
But so sore nipples. So only one I know really for that was cabbage, which is the weirdest thing. You take a cabbage, like a real cabbage leaf, and you put it inside your bra against your breast.
Yeah. So
And it really works.
yeah, I've heard it. So cabbage leaves, yeah, they're awesome for engorgement when your milk first comes in. Now, the one thing that I would say is you don't want to go like overzealous with cabbage leaves because they can be really soothing, especially if you take them right out of the fridge. It just has that cooling effect. But cabbage leaves are also used to dry up your milk. And so it's something that you want to kind of find the happy medium if you don't want to overuse it. So you'll usually hear people say you can use 1 cabbage worth.
Okay.
You just don't want to do a cabbage a day.
Would
Just do one.
coleslaw work better?
Sauerkraut, actually.
Sauerkraut,
It's
just
St.
fill the
Patty's
balls,
Day.
sauerkraut.
Just rub it all in.
That way it's fermented.
Yeah.
I like that. I like that you just roll with this. So
Yeah, why not?
And then lanolin, which is from sheep's wool. So you never, ever want to use baby oil, Vaseline. Those are all petroleum products.
Mhm.
But lanolin is from sheep's wool. And it's actually how you get vitamin D3 in your supplements. But the only problem with lanolin is it's really thick and hard. And so, like, you can dilute that with a carrier oil. What would be, like, your favorite for that?
I like coconut oil, personally, just because it's a little thicker and has a little bit more of a salt to it. But yeah, I mean, whatever your favorite oil is, something to think about is like if you're putting something on your nipples, is this something that you would put in your mouth? Because it will be going in your child's mouth. Yeah. And so choosing a food grade oil is important. So
yeah, I feel like a grapeseed extract maybe, because I'm grapeseed oil, because that's an antihistamine maybe. But that you may be decreasing. You don't need to be decreasing that. Yeah. Coconut oil is probably like.
I mean, it's an antifungal, antibacterial.
Yeah.
Cheap. You have it around. It's a good one.
You should use the one from the fridge and don't tell anyone. That's what for sex lubrication too. Like coconut oil is like one of my patients' favorites. But I'm always like, probably get a separate one for the bedroom, maybe.
Level around.
And then galactologs, we talked about that. I mentioned that crazy word. So those are things that you can consume that make your breast milk increase, right? So stimulating nipples helps. Milking the breast, like
a breast massage.
Breast massage. See, that's why we have husbands, because I'm so willing to do those things to help. But milk thistle, that's one that actually grows in the yard. So you ever eat bull thistle? You ever eat weeds at all? Like I'm always eating
I'm always too nervous. There's been a couple times where I've thought about like eating berries too, and I'm like, I'm gonna die.
I'm always eating clovers and dragon heads and all those kind of things, you know.
You're so bold.
And um, the bull thistle I like because you can pull the purple stuff out and you just eat it, right? But so I was on, me and a girlfriend went to Rollin, Missouri to this fugitive beach, right? And so I'm going to go jump off the high platform, and like she found a flower and she brought it to me, and I just was like, oh, thank you, and I ate it. And then she was like horrified. She was like just sitting there like, what did you do? Which, A, why are you going to bring me a flower when I'm going to jump off the platform? But I've been eating weeds for so long. Like, I thought she knew me that well.
Can you do an edible weeds podcast?
I did, and we had a
Really?
special guest was Dr. Oh, damn it, what's her name? She's so awesome. But she was in Australia, and I was here, and we had a show together, and she was at like the botanical gardens there in Australia, in Brisbane, I think. Carrie, Dr. Carrie. And so that was like awesome.
That's so cool.
Yeah.
Yeah, I want to learn how to be a hunter-gatherer.
Purslane is
Someday.
awesome. Purslane tastes great. And then I was eating lots of what I thought was wild sage. And then Dr. Ola, she used to work at Visclinic, but she's now down in Florida. And she's like, I don't think that's that. I think that's wormwood. Now, technically, it's called
Isn't-
Western sage, but it's wormwood.
Isn't that bad for you?
No, wormwood. So wormwood's an aphrodisiac, and it's your typical thing for an anti-parasitic.
Yeah.
Yeah.
Huh.
So it did not work as an aphrodisiac for some reason, but I ate a lot of it. But I've always took wormwood, which I thought was sage. Anytime I have a wound when I'm hiking, I just rub it on there, and it doesn't get red or anything. Like, it's wonderful, but because I'm always off the trail. But then I found out it's wormwood, so then I don't know.
I don't know.
It's fine. Works the same for me. It smells like sage. So I don't know if that counts. But also with milk is women tend to be dehydrated, subclinically dehydrated. So women between 40 and 60 will shrink 2 to 4 inches. But it's not bone shrinking. It's all the fluid spaces dehydrating. So as we drink a bunch of diuretics and we don't drink enough water, so then it goes back to, do you want to make milk? You probably need lots of extra water. So the formula is half your body weight in ounces of water, half your body weight in ounces. So if you weigh 128 pounds, that's 64 ounces. That's 8 glasses. That's your standard recommendation, which was the average size of an adult in 1910. If you weigh more, you need more water. Plus, your placenta is all water, right? So you need lots of water anyways. But then to make extra milk, you need more water.
Your placenta's all water?
No, what's in it? Amniotic fluid.
Okay.
That's all water. So you should be drinking water a bunch anyways.
And I think also with milk supply, a lot of women notice a drop in their supply around 6 to 8 weeks, or sometimes 3 months. And sometimes that can come with the return to work. But often it comes with women who are trying to get that pre-baby body. And so they're starting to cut their calories, cut their carbs.
Yeah.
And so breast milk, you can check my stats, but I believe it's about a third carbohydrates, simple carbs that baby can eat. And so if you're going to all salads, that's also going to cause a dip in your milk supply. You still need to be getting some good carbs. So whatever your favorite carb is, oatmeal, rice.
Not sugar.
This is true.
Not sugar.
Your favorite complex carb.
Complex carb. I like that. Okay. So what are some of your favorite herbs then? This is your show for this. And all that. I'm going to read you. So tell me, Dr. Kaufman. So, like, I always recommend fennel and fenugreek.
Mm-hmm.
But in fennel, so fennel tastes like licorice, is that right?
Black licorice, yeah.
And then fenugreek tastes like maple syrup.
Is it?
Did
I've
you know
never
that?
had fenugreek
The little thing.
solo.
Yeah.
I've had like fennel alone.
Yeah.
I've never had just fenugreek.
So fenugreek, they're hard as hell. Like, they'll break your tooth, right? So you take those, and I always have like take it like a teaspoon and put it in hot steeping water, and then they can let that soak overnight, and then the next morning drink the water in the fenugreek. And so
That's
then
awesome.
it's nice and soft and pliable. But people grind it up, take it as a supplement.
Yeah,
You can
it's
add
in
it to
just
food.
about every lactation product out there.
Is that right?
Yeah, you can get like
Yeah.
lactation cookies, lactation milk, lactation tea.
Oh, that would
You go
taste
crazy.
so good.
It's pretty awesome.
Starve anise or fennel. Okay, so fennel and fenugreek in something would be anise and maple syrup. Do those go together?
Why not?
I don't know.
I think it's work.
And there's a few others. I saw that garlic increases breast milk, but that's not one I would normally think about with that. Energy wise, so I have heard that moms are tired. Is that true? That doesn't seem right. Look at you.
They're just lazy.
3 weeks postpartum, she's like all just like whatever, all energetic, right?
I nap a lot
Nap a lot. Okay.
because I don't sleep at night.
Oh my gosh. That's the craziest thing is when moms become like they're never like in deep delta wave sleep. They're just kind of in theta wave, and they're just like, did she stop breathing? Is she breathing down the hall?
Yeah.
Okay, she's breathing. Like, man, I can't hear anything. Like, I don't know what you're talking about.
Yeah. The other day, my kiddo, when she was like 2 weeks, she slept for 6 hours straight, and like you just wake up and you're like, are they alive?
Yeah.
Why aren't they? Why are they asleep? And like you just stare at them, waiting for like their belly to move. Oh
Yeah.
gosh, the paranoia.
Oh, it's all good times. You're just like, why can't you people be quiet? And then when they're quiet, you're just like, are they okay?
What?
Okay.
What's going on?
So apparently moms need more energy. So you don't want to do that with caffeine, which will pass through your breast milk. And caffeine, so you need about 350 milligrams, which is the Venti Mocha from Starbucks, to cause anxiety all day, right? It takes about 6 hours to get the caffeine out of you, but it stays in the baby 80% longer. Do you know that?
No.
So that's so moms that are pregnant or using caffeine, they're getting that baby jacked up. But postpartum, you're still going to pass it through your breast milk. So methyl B12 and coenzyme B complex, so those B vitamins, you can abuse the hell out of those, and you will feel amazing. So it's a great way to fake it till you make it. But start out with like 5,000 micrograms of vitamin methyl B12, and that literally will change your DNA. It's an epigenetic process that you have with methyl B12. But also the coenzyme B complex or methylfolate would probably be a great one to add. Methyl tetrahydrofolate, because those regulate the pathways called the homocysteine pathway, the folate pathway, and the bioterapin pathway. Those 3 pathways regulate brain function, mood, memory, detoxification, thyroid, sleep, mood, and behavior.
So they do a little bit.
Yeah, so that's kind of like a good thing. It's called I want to feel happy. So I love those because again, people feel like maybe taking 1 or 2. Man, take like 5, 3 times a day. If that's what you need in the beginning, take it. Fake it till you make it, and eventually you won't need it. The only one you don't want to take by itself is B6. B6 by itself can jack you up to where you feel fantastic, but you will not sleep. You'll be in bed at like 4 in the morning going like, I feel great, but I cannot sleep. So don't take that one by itself. And then green tea, white tea, yellow tea, black tea, oolong tea is all the same plant. So it's just oxidized or antioxidant. So white tea and yellow tea has 15 milligrams caffeine, which should make you feel smarter, more energetic, more balanced, but it shouldn't make you jack up and crash. Same thing with green tea, which has 25 milligrams caffeine. But black tea has 50 milligrams. But again, a little cup isn't going to be a problem. But a Route 44 black tea is going to cause you to have anxiety all day long. Okay? So white tea, yellow tea, green tea, that is nootropic medicine. You can buy expensive supplements, or you can just drink your cheap-ass green tea. So I'm voting for the tea. So green tea and B vitamins. And the coenzyme B complex I like from Country Life because that one is already reduced form on that. So And then, are we an hour?
Yes.
Holy crap, it's been an hour. All right, so we'll briefly go through the rest. And then ask your questions offline. And then if you want to join Dr. Kaufman's group in Harvey County, do you have to live in Harvey County to go?
No, you don't. You don't have to. I mean, if you live there, work there, you might be around, but anyone's welcome to come. There's no, and we mentioned it's grant funded earlier, but it's open to anyone of any demographic, income, whatever. If you want to come and hang out, we've got, well, when we're in person, we've got snacks, and there's different incentives that we come out for attendance as well. So
Nice.
Lots of fun stuff.
And how do they find out more information too?
So because of the situation, I'm not sure whenever we'll move back to an in-person setup. So the best place, is to find us online. You can find me on Instagram or Facebook at Sway Harvey. And that's going to be where you're going to be getting the most of your updates and different things along those lines.
Why do you call, Sway, what does Sway mean?
So the reason I chose Sway as our name is that I think that Sway includes the two things that you need to have a happy and whole life. So to be rooted in your principles and to be grounded in who you are, as well as the flexibility to adapt to the unknown. So in order to be both grounded and flexible, that gives you the ability to sway.
Nice.
Yeah.
That is nice. So on Facebook, it's Sway Harvey?
Yes. And then on Instagram, it's Sway_Harvey.
Okay.
So you'll find it basically.
And Harvey is Harvey County.
Yes.
Not some dude named Harvey. Or some magical rabbit.
Harvey Weinstein did get like 23 years in prison.
Good.
Sorry. That's my Harvey note. Good.
He and Bill Cosby can have a good time in prison. So bowel function. So we'll go through the rest of these a little bit quicker since we're out of time here. But bowel function is a big problem.
Especially that first one. First one post-birth. You're a little nervous about the whole thing.
If you have a bowel movement during the birthing process, does that count as your first one? Can you go home after that?
No.
Damn it, man.
No.
All right.
You probably will, though.
So
it doesn't count.
So lots of water, natural con or mag citrate. Citrate is the one that you want for bowel movements. If you take enough, you will poop. So it recruits water and then moves things further. The other thing you need for bowel movement is fiber. So again, junk food won't do it, but fruits, vegetables, nuts, seeds, berries, legumes, greens. And then for sleep, yogi bedtime tea, and we had to look this up too because valerian root's a wonderful adaptogen. At low doses, it's great for anxiety. At high doses, we use it as a muscle relaxer and to help people go to sleep, stay asleep. So you can take it, especially if you take it before bed. It lasts for about 3 hours. It's half-life 3 hours. So that's a good one, especially if you're nursing. It said it's safe or recommended for nursing. In one research journal, the one that you were going to, it was more medical. It didn't have it in there, but so probably stick with low dose, 200 milligrams, 1 to 3 times a day. And
you mentioned that you said the half-life is 3 hours.
Yeah.
Yeah, and generally you want to consume anything during breastfeeding with a half-life of 2 to 3 hours. That's a really good ballpark. And if that's the case, then while you're breastfeeding, you take it because most kids go about 2 to 3 hours between feedings. So if you take it while you're breastfeeding, it's probably at least gone through one half-life by the next feeding.
Cool.
So
good.
Good rule of thumb.
And then pelvic bowl practices. So with Kegels and then dietary changes that causes. We talked about those. And then also raspberry leaf tea. Blood loss you talked about. So you said they can lose up to 1 liter in vaginal birth. So blood is water, so you got to replenish all the water. And then you need lots of iron. So iron is from plants, but also stored heavily in organ meats. So not piano meats, but more organ meats.
Yeah, you've got that blood loss at the time of birth.
And then liver, kidneys, heart.
Yeah, I love liver is my all-time favorite organ meat.
And organ meat is so healthy for you.
It's huge.
But Americans do not eat it. It really is.
The secret is hiding it. So I puree it and make liver pate, and then you
Ooh.
just mix liver pate into everything you make that's like ground. So if
Yeah.
you make a soup or a stew, you just take a spoonful
Little
of liver
bit.
pate,
That's smart.
and
Yeah.
if you make a big enough pot, you lose that irony flavor,
Yeah.
but you get all the nutrients. Same thing
Nice.
if you make like a meatloaf or a meatball, just throw in a couple spoons of liver pate.
A little pâté de foie gras.
Yeah, and it makes you fancier too.
Nice.
Win-win.
And then if you're going to take iron, the one that you really want to take that's most therapeutic. Now, it's a little bit harder to find. You can get it off Amazon. It's harder to find in the health food store. But ferrous, which means iron, and then fumarate. And that has a third of the absorption rate. The biglycinate, which is the most common one you'll see, only has a tenth. So if you're saying 300 milligrams, one of them you get 100. The other one you get 30, so it's a big difference. And then restoring hormone balance. So we talked about Vitex Cactus Agnus, which is chasteberry, which is one of my favorite, very subtle ways to kind of rebalance hormones. So that's a wonderful one from beginning to the end. And then the last thing was the mindful practices. So we'll end with this. So with mindful practices, it's hard because there's the desire sometimes to take psych meds, but they also pass through lactation. So usually moms can't do it, so they're kind of left without any help, right? But balancing hormones is not about situation. It's not about other people. It's finding your resiliency, neuroplasticity, rewiring your own brain for this. So one of the biggest things ever is to don't be a martyr.
Mm-hmm.
Just don't be a martyr. Being a mom is not a martyr, because all you're going to do is show your kids how to fall apart when they get older. You want to be the healthiest and happiest regardless of what your spouse does or what your partner does or what anybody else does. You be the healthiest and happiest, which means you have to take time for you, which means it's okay if grandma takes the baby. It's okay if your parents take the baby. It's okay if the kids watch the baby. It's okay because they're not going to do it the right way, but that's time for you to get healthier and happier. You have to be okay with imperfection, with not everybody's going to sterilize their hand and hold the baby right. The baby's going to eat dirt and rocks. It's going to be fine. It's going to be fine, right? So part of giving that up, of saying it's okay to allow imperfections, allows you to then go to the movies by yourself, or go read by yourself, or go have girls' night out by yourself, or not by yourself, with your friends.
Or take a nap.
So you can go. Oh yeah, or take a nap.
Take a nap.
Holy shit! Take a nap, right? Make them leave with the kid so you can take a nap. That's probably the best.
Yeah, for real. Like, get a babysitter just so you can schedule nap time.
Yeah, get a babysitter. Go to there's sites for that, but get a babysitter. It's okay. Get one with references.
Yeah, I think it's important to acknowledge the village mindset of creating we talk a lot about a birth team, who's going to be there at the birth. Well, you also need a postpartum team. So who's going to be on that team?
Postpartum team.
So that can be professionals, counselors, therapists, postpartum doulas, people who are going to make you food and meal train you.
Yeah.
Those people, but then also your personal, who are the people that you can lean on whenever you're feeling tired or you're feeling stressed or sad, and having those people in your life too.
Absolutely.
And tell them ahead of time. Say, hey, this is coming up and I'm going to be looking for you to support me.
I think that's great. You probably have done a show on that, but I think a show on figuring out your postpartum, have a lineup,
Yeah.
I think that would be amazing.
Yeah, there's a lot of amazing.
Because you need a massage therapist.
Yeah.
You might need a a cognitive behavioral therapist or a dialectical behavioral therapist.
Mm-hmm.
Again, to deal with all this stuff, and someone to babysit, and
asking for help is huge.
Yeah,
it's not something that you should feel guilty about. It's what people want to do.
I remember
honestly.
as like a gesture, like I hired a maid to help clean our
Yeah.
house. Now I'm stay-at-home dad, so I clean too. That's not a big deal, but just to kind of help with all the stuff. And she actually got angry because she was like, "Well, I'm embarrassed. I don't want someone to see, all the mess." I'm like,
Mm-hmm.
"Oh, we just had a baby. Nobody expects our house to be anything but a
Yeah.
mess. Like that's fine." But that sense of like, why would you? Who cares? Like, allow other people to come into your life and help, so you don't have to do all that. Because your progesterone drops, you better be doing stuff to build it back up. Because progesterone gets exhausted through cortisol, and if you don't stop exhausting your hormones, you're gonna feel like crap very quickly.
Mm-hmm.
So, because I'm a dad, I know. I mean,
Love on yourself and let other people love on you.
that's
They
right.
want to.
And never blame yourself, and don't have regrets. Whatever you did, that was the right way at the time.
Yeah.
So.
You made the best decision with the knowledge you had at that time.
Yeah, because some people are like, well, I wish I wouldn't have got the meds, or I wish I wouldn't have had a cesarean, or I wish I would have did natural, I wish I would have did a tau, I wish. You gotta have enough regret raising a kid anyways. Stop second guessing everything. Whatever you did, that was the right thing to do at the time. So meditation for mommies, don't blame yourself. No matter what, you're not broken. So even if you have baby blues, tired, exhausted, you're not broken. You just have to recharge. And then I like what you said, slow is fast.
Yeah.
So tell us about that.
Yeah,
As
so
we
slow is fast is this mindset of taking time right now, these moments to do what you need is going to help you recover faster in the long run. So you don't need to push yourself beyond your boundaries. Just acknowledge where you're at and honor that, and you'll heal faster and get back to who you want to be
Yes.
sooner.
And then the cortisol will erase all the trauma.
And
And
you'll
then
do
you'll
it
be like,
again.
let's do this
it
again.
again.
Let's just have 4 babies, and that's a great idea. Which, if you have, my friends, they had 5, which, good Lord, you know what they're doing in their spare time. And then I had 4, and then we would, like, anytime we go out, we'd be like, we need a table for 9, 10, 11, 12, 13. That can't be right. That's not a real number.
It's huge. Yeah.
13 people for 2 families. So, oh my gosh, it gets crazy. Maybe 2 babies. I don't know. All
No
right.
take backsies.
No take backsies.
You've got 4.
And for guys, once you guys are done, guys get vasectomies. Women don't get their stuff chopped out.
I like that.
Leave their stuff. You just get 2 little snips in the office. It's nothing. It's nothing. And then you will have a happier life. Okay? So, all right. Anything else?
You have a show tonight.
I have a show tonight. So we have Jesse Griffith on the Dr. G show tonight, which is in an hour and 15 minutes. So I got to run over there. And I thank you so much for letting me be a part of this.
Yeah, awesome. Thank you so much for being flexible and
Yeah.
moving it to this format.
A quarantine couldn't even stop this, right?
Nothing.
The
Nothing's getting in our
government
way.
tried to stop us, and we were like, screw that. We'll be fine.
Yeah.
All right.
No. That was
And
awesome.
tomorrow, I'm having a live show that was supposed to be at OptiLife, but they canceled all theirs. But we're going to do that on coronavirus, and that'll be our 3rd one, the update on all that. So it's a very factual, latest research, common sense approach to it, not all the freak out hysteria that's going on. And then I think Thursday we're supposed to do a show at Natural Grocers on the east side, but they canceled all theirs because of coronavirus. So we'll probably be doing a live video on that. So we have this, the Dr. G show, and then 2 more. So we have 4 live talks that we'll do this week. So please join us. I posted events for that stuff. But and then if you want to get more information on Dr. Mallory's group, Sway Harvey on Facebook,
And
or Sway_Harvey
on Insta.
Instagram.
Insta.
Are you doing like this on Instagram, like that? You showing your
Yep.
baby like, come on.
Always.
Yeah.
Yeah.
You have an Instagram baby? Are you doing that with your baby? Making it all Instagrammy?
Oh, actually, I don't think I have any baby pictures on Instagram. They're all on Facebook.
Are you doing TikTok stuff with the baby?
No, I'm not that
You go
hardcore.
like that to the music?
I have not learned how to tick nor talk. So
Neither.
someday, maybe.
I asked my kids what TikTok was. They were like, you gotta get TikTok. And I was like, what's TikTok? And they're like, oh, okay, boomer. All talking smack.
Ruthless. All right.
All right. Thank you.
Thank you.
Bye, you guys. Post
See
your
you guys.
questions. Dr. Mallory will look through those too and help answer stuff too, and I'll help.
Mhm.
But thank you guys for joining us.
Stay safe. Wash your hands.
Wash your hands. All
That
right.
one too.
And this one,
In strength.
boom.